Nutrition is very important before, during, and after your transplant. Most people lose roughly 10% of their body weight from diarrhea and lack of appetite. For those with trouble getting food down, there is a dietitian on staff. Everyone will see the dietitian at least once at the beginning of their stay. Some will see them a second time if they're having trouble eating. The dietitian is there to help you work out a strategy to start eating again. Often the solution is smaller meals that are high in protein, which lessens the amount of body fat you lose. The Dining on Call program is how you get your meals. You may order anything off the menu as well as from the cafeteria from 6:30 a.m. to 8 o'clock p.m. Usually orders take 45 minutes. There is also a pantry on the unit. It's stocked with snacks and has a microwave, coffee maker, and milkshake machine. There's a small refrigerator in each room to store your own food from home. You may also get nutritional drinks and supplements to try at no charge. You may eat food from restaurants as well, as long as you follow these guidelines. No raw meat, no raw fish, no raw poultry, no raw eggs. Avoid foods from salad bars and food bars. Fresh fruit and vegetables are acceptable as long as they've been washed and did not come into contact with surfaces that may cross-contaminate, such as cutting boards. These same guidelines will continue after you've been discharged. Fluids are also very important. You need to drink at least 8 8-ounce glasses of decaffeinated drinks a day. Caffeinated drinks are allowed, but tend to dehydrate, so they don't count. Also, if you're losing a great deal of water through sweat or diarrhea, you will need to drink even more to make up for what you lose. Every day, the nurse will keep track of how much you drank, how often you used the restroom, and what activities you did. This information goes into a charting system for the doctors. The doctors look at this report along with the blood counts. If you aren't getting enough fluids, it is likely it will delay your discharge, even if your blood counts are up. This is because one of the top reasons patients find themselves back in the hospital is dehydration. You should be honest about what you drink. If you didn't drink enough, but tell us you did, you're only hurting yourself. On the other hand, you want to make sure everything you do drink gets recorded. It's important that you continue with plenty of fluids after you're discharged. To help maintain your fluids, you'll be hooked up to an IV pump for the majority of the first 3 weeks. The first week, you'll have it the entire time. The next few weeks, the pump will come and go depending on how much you're drinking.